Hello, I'm here with my group, which consists of Sola Lee, Rachel Wynn, Morgan Reed, myself, Allison Scott, and Anna Wang. So our research project was on reducing opioid use in pediatric critical care and the role of nurses in implementing equitable non-opioid analgesia protocols. So for our introduction, opioids have long been the primary pain management strategy in pediatric critical care, despite risk of dependence, respiratory depression, and neurodevelopmental harm. Although perioperative opioid use is declining in favor of non-opioid options, concerns remain, showing that 4.8% of adolescents prescribed opioids after surgery develop new chronic use versus 0.1% without surgery. These risks underscore the need for structured, evidence-based, non-opioid alternatives in PICU settings. Nurses are central to the shift, serving as advocates, assessors, and coordinators of care. Nurse-driven anesthesia protocols have been shown to reduce PICU length of stay and improve outcomes. This project evaluates PICU patients using nurse-led non-opioid protocols versus standard opioid benzodiazepine-based care on pain control, safety, and recovery.
And as far as search methodology goes, we used PubMed and CINAHL as our main databases of choice. Keywords for this project, our searches included pediatric pain management, nurse-driven protocol, opioid use, non-opioid analgesia, postoperative pain, and non-pharmacological intervention. Inclusion criteria, we wanted peer-reviewed papers, ideally in nursing-related articles, just given the nature of our project. Published in the last 10 years, ideally the newer the better, 5 years or less. I believe only one of our papers chosen was over 5 years old. And then we wanted to focus on pediatric populations. Any paper that was a systematic review or meta-analysis, those were excluded from our literature. As far as synthesis findings go, a few main themes we noticed. Implementation of nurse-driven pain management and sedation protocols can reduce opioid and benzodiazepine use, plus decrease length of time in the PICU. Both Hanser and Lores showed similar results across different PICU settings. And then non-opioid analgesics have been found to achieve comparable pain relief to opioids in pediatric post-operative patients. So this suggests that these medications can be a safe alternative without compromising comfort. And then finally, another theme, non-pharmacological based interventions such as music therapy and hand massage can be used to mitigate pain, fear, and stress in PICU patients. So this can be used as a complement to pharmacological strategies and support a broader holistic approach to pain. And just overall in our synthesis, studies varied in their approach. Some were more pharmacologic in nature versus the non-drug methods, which indicate to us that both of them are valuable tools in building a comprehensive pain management algorithm that nurses can implement. And going off of that, across the literature, nurses were just key players in general in ensuring that these protocols were adhered to, thorough pain assessments were conducted, and any non-opioid modalities were successfully integrated into patient care.
Our synthesis shows that nurse-led pain protocols and evidence-based practice assessment tools reduce sedative and opioid use, and consequentially can shorten PQ stays by maintaining patient comfort and helping them through their recovery. So by prioritizing non-opioid medications and integrating non-pharma interventions like music therapy and hand massage, nurses can adequately address the physical as well as mental toll that pain has taken on their pediatric patients. So these findings emphasize that early consistent assessment and interventions that prioritize avoidance of opioids I'm sorry. These findings translate into evidence-based nursing practice by emphasizing early and consistent assessments and interventions that prioritize avoidance of opioids unless necessary, because we want to avoid withdrawal symptoms in our little patients as much as possible. So these research also show how nurses can advance health equity. One by opioid misuse risk is higher in patients with limited access to follow-up care and resources. We tend to give those patients a short-term relief instead of a long-term recovery. Nurses can promote equity by integrating standardized nurse-driven pain protocols in electronic health records, collaborate with the healthcare team to create discharge plan that limit opioids and provide adequate alternatives, educate families on non-pharmacological pain management. This is very important to use at home. By ensuring every child, regardless of their background, receives consistent evidence-based pain management, nurses can close care gaps, reduce long-term opioid risks, and promote equitable recovery outcomes in the PICU. So us nurses or as future nurses play quite an important role in this pain management. Next.
Absolutely. So in conclusion,
All right, so in conclusion, further research is needed on the long-term effects of non-opioid anesthesia and standardized nurse-led protocols. Gaps remain in understanding how follow-up care, access, health literacy, and socioeconomic status influence opiate misuse. Exploring ways to adapt nurse-driven pain management and promote health equity, especially for low-income families, is essential to ensure safe, effective, and equitable care for all pediatric patients. And here are our references.